Hi, thank you so much for waiting. My name is Priyan and I am the nurse on duty for today. Are you Miss Cyril Pipito?
Yes, I am.
And am I pronouncing your name correctly?
Yes, you are.
Okay, so we have here a prescription for Cotrimoxazole, 800 milligram over 160 milligram tablet sent to you by your doctor, Dr. Flores. Have you ever taken this medication before?
No, not yet.
Okay, so because it is a new medication, I want to go over it briefly with you to answer any questions that you might have and to make sure that you're taking this medication correctly. Do you have a couple of minutes to spare for me?
Yeah, sure.
Okay, before we begin, I want to make sure that our patient profile for you is up to date. Are you still living on 213 Tipadilla Street, Cebu City, Philippines?
Yes, I am.
And um, is your date of birth March 14, 2000?
Yes.
Okay. And your active phone number is 0995 623 9749.
Yes, it is.
Okay. Thank you so much. I just want to ask, do you have any allergies?
There's none that I'm aware of.
Okay. And are you taking any over-the-counter medication, maybe for headache or for pain?
Yes, I do take paracetamol for headaches.
Okay. If you do start taking any other medications, it's good to let your doctor or pharmacist know just to make sure that there's no drug interaction.
Ah, okay.
Okay, thank you. And because this cotrimoxazole medication might hurt a potential baby, I was wondering if you're currently pregnant or planning on becoming pregnant.
No, no, no. I'm not pregnant. I'm not planning to be.
Okay? Well, if you are sexually active, we can talk about contraceptive options afterwards if you'd like.
Ah, okay.
Okay? So now, we'll begin talking about your new prescription, Cotrimoxazole 800 milligram over 160 milligram tablet. Um, what did Dr. Flores tell you this medication is for?
I was actually really nervous that time. I didn't pay attention, so I thought I was just going to read the prescription right after. And now I have no idea what it is.
Oh, it's okay. Don't worry, we can go over it. So, this medication is an antibiotic that is used to treat bacterial infections such as bladder infections, urinary tract infections, skin infections, and chest infections. It works by killing and stopping the growth of bacteria that causes the infection. Cotrimoxazole is available as a tablet, oral liquid medicine, and injection, but in your case, you are prescribed to buy tablets. Now, technically, cotrimoxazole is the generic name of your medication, but it comes under general brand names like Bactrim, Septra, and Sulfatrim.
Ah, okay, okay.
Okay. Next, how did Dr. Flores tell you to take this cotrimoxazole?
Again, sorry, I don't remember.
Oh, it's okay. So, I'm going to explain it to you. So, it's going to be a little tablet. You have to take two tablets a day for 7 consecutive days. You'll take one tablet in the morning at 8 a.m. after you eat your breakfast, and you'll take the second tablet in the evening at 8 p.m. after your dinner. This should be taken with a full glass of water and should be taken after eating because this lowers your chances of stomach complaints. And if you want, you can set a timer on your phone just to remind you every day of your medication. I can show you on your phone afterwards if you'd like.
Oh, it's okay.
Okay? And then next, did you remember what Dr. Flores told you regarding the effects of this medication?
No.
Oh, okay. So, in addition to treating your urinary tract infection, Miss Cyril, there are common side effects in taking this medication. The most common side effects of taking cotrimoxazole are nausea, vomiting, loss of appetite, and headache. I want you to stick through this because they're going to go away on their own as your body adjusts. But if any of the symptoms are severe or do not go away, I want you to call your doctor immediately, okay?
Oh, okay.
Now, if you experience severe bloody diarrhea, shortness of breath, and if you develop skin rashes or any allergic type reaction, I want you to stop taking this medication and call your doctor immediately. And then we'll switch over to another medication. Is that clear?
Okay, I'll remember that.
Now, I know I went over a lot of information, and just to make sure that I'm clear, would you mind going over the basics of how to take your medication in a day?
Okay, so I take two tablets a day, one at 8 a.m. and one at 8 p.m. with a glass of of water.
Yes, that's right. Now, I want to talk to you about antimicrobial resistance. Have you ever heard about that?
No, I'm not aware of that.
Okay, Miss Cyril. Antimicrobial resistance happens when germs like bacteria and fungi in your body develop the ability to defeat the drugs designed to kill them. That means that the germs are not killed and continue to grow. Infections caused by antibiotic resistant germs are difficult and sometimes impossible to treat. Do you know why this happens?
I'm not so sure.
Well, antibiotic resistance occurs naturally in some microorganisms due to antibiotic usage, but misuse and overuse of antibiotics are accelerating the process. Hence, it is important that you should not interrupt or stop the treatment. You should finish it completely even if your infection has cleared up because this does not mean that the bacteria have disappeared. Okay? This is to prevent the infection from coming back and being more difficult to treat. So, finish your treatment according to your doctor's prescriptions and don't forget to take your medications on time. Are we clear?
Okay, mom, but what if I forgot to take my medication?
Well, if you forget to take a dose of cotrimoxazole, take it as soon as you remember. If it is almost time to take your next dose, when you remember, skip the missed dose and take your next dose when it is due. Remember, Miss Cyril, do not take two doses together to make up for a forgotten dose. And also, never take any medication more than the prescribed dose.
Okay, I'll keep that in my mind.
Okay, is there anything that you're unclear about, or would you like to ask some more questions?
So where am I supposed to place my medication? Should they be refrigerated?
Well, ideally, you should store it in a cool, dry place away from direct heat and sunlight. I would not recommend storing it in refrigerators because low temperature may cause moisture.
Okay, mom, that's noted.
So, is there anything else you'd like to ask or clarify?
No, I'm good. You explained very well everything very well.
Well, that's good to hear, Miss Cyril. One last thing I'd like to remind you is that this medication is prescribed for you. So, never give it to other people even if their condition appears to be the same as yours.
Oh, great. Thank you so much.
Okay, Miss Cyril, I think we're good. So again, my name is Priyan, and if you think of any other questions, Just give me a call and I would be willing to help.
Okay, thank you, Miss Nurse Priyan.
Thank you. Thank you for your
Thank
time.